So we'll go ahead and get started. And good morning, good afternoon, depending on where you're joining us from. My name is Gita Umbure, and I work on Ideal as a senior technical advisor for food security. I'd like to welcome all of you today to this event on protection mainstreaming in emergency food security activities, which is part of Ideal's COVID-19 learning series. As we begin this session, please take a moment to introduce yourself in the chat box. As you come in, let us know your name and where you're joining us from. We really appreciate you doing that. Before we begin, we'd like everyone to be aware that we'll be providing French interpretation for this event. If you'd like to follow the event in French, you will need to click on the small globe at the bottom of your Zoom screen where it says interpretation, and then select French. Once you've selected French, you can choose to mute the original audio, or you can hear it in the background at a lower volume. We have also provided a link in the chat box for the presentation slides in French. Also, later in this session, we will be going into breakout groups. Thank you for staying on mute. And thank you for joining us. So as I was saying, later in the session, we will be going into breakout rooms. We'll be offering a breakout room in French for our Francophone colleagues. If you prefer to be in the French breakout room, please identify yourself in the chat box now so we can be sure to put you in the right room when the time comes. You can simply type French in the chat box and we will take note of your preference. If you have any technical issues during the webinar, please send a chat message to anyone with Ideal in their name, and we will do our best to assist you. If you're able to, please activate your cameras. We are also asking people to remain on mute while others are speaking. Unmuting yourself is a cue for us that you would like to speak. You may also raise your hand by clicking the Zoom icon for this to indicate that you'd like to speak. I would like to pass it over to my colleague, Kevin McNulty, who has been working with us on Ideal to prepare for this event in the capacity of protection advisor. Kevin has been working on protection programming with a particular focus on gender-based violence in emergency settings since 2000. Most of his program management work has been in many countries in Africa, and he has been providing technical assistance across MASICO programs globally for the last 5 years. Over to you, Kevin. Kevin, are you there?
Sorry about that. As usual, mute wins. Hi, everybody. Thanks so much, Gitao. Yeah, so it's great to see so many people in the chat. If you can put on your cameras, that would be great. Then we can see your faces as well. Of course, only if the internet, your internet connection allows you. So for this event, by the end of the session today, we want to identify key challenges faced in mainstream protection as ESSAs adapt programming for COVID-19. Review different adaptations made to mitigate protection concerns related to COVID-19, to identify lessons learned and promising practices. Map out capacity gaps and opportunities for advanced peer-to-peer learning that will improve protection mainstreaming across ESSAs. So what I wanted to say before I move on is just thank you so much for doing your preparation before this this event, because it's really helped us shape how we're going to continue this. With that said, here's today's agenda. We'll start with setting the stage on protection mainstreaming so that we are all on the same page. We'll then break out into breakout rooms to discuss your efforts to mainstream protection since COVID. And finally, we'll report out prioritized learning and make next steps. To begin, we'd like to discuss protection mainstreaming and how it impacts emergency programming during COVID-19. And I'm going to do a short presentation to make sure that we're all on the same page when we have our discussions. Great, if you can go to slide the next slide. There, perfect. So since the beginning of the COVID pandemic, there's also been a shadow pandemic of protection concerns amplified by COVID and having disruptive consequences to people's well-being. This is also having ramifications on food security. Populations that were hard to reach are now harder to reach. COVID has led restrictions on humanitarian access, which means that less services are available and the services that are available are curtailed. Populations who were easy capture are now hard to reach. People who were hard to reach before because of issues of mobility or access to communication, like people with disabilities, the elderly, people with health conditions, are now more secluded as they try to avoid risks of getting the disease. And they are in public spaces for smaller period of times, making our chances to interact with them less. Marginalized populations like displaced people or people with health conditions are becoming easy scapegoats and blamed for spreading the disease, pushing them further into isolation. As you are well aware, displaced people are not a monolith, and they are a diverse group of people with different needs and who have different avenues to reach them, adding complexity to their vulnerability. Prior to COVID, people who are vulnerable because of socioeconomic issues, such as female-headed households and minorities, tended to meet their basic needs to work in activities that have high contact with other people. In the COVID world, however, where we want to minimize contact between people, they are no longer able to work, or because they have high exposure of their work with person-to-person contact, they are at higher risk of contracting the disease. It's also harder to reach them because they are working more to meet basic necessities, and they are no longer in public spaces where our paths would cross them. Protection issues have also intensified. For instance, we know that the loss of income, the stress of food insecurity, the confinement of restricted living spaces has triggered an upsurge in intimate partner violence, child neglect and abuse, the neglect and abuse of the elderly and people with disabilities. As families address food insecurity, many have reverted to negative coping mechanisms that can put them at harm, such as survival sex, child labor, and early marriage. It's a spiral of calamity, where a health issue negatively affects the livelihoods, food security issue, which negatively affects a protection concern, putting people at further risk of the disease and spiraling down again. Yes, these are problems and they are daunting, but there's much we can do to avoid worsening the situation. First, through protection mainstreaming, where we can make sure that our programming is not adding to the problem. Rather, it can be a respite from the calamity as people are able to access food assistance that they need in a safe and dignified way. Can you go to the next slide, please? So protection mainstreaming is the process of incorporating protection principles across humanitarian programs to promote safety and dignity, meaningful access, accountability, and participation and empowerment. Next slide. Often, when we think of protection mainstreaming, we think of four principles. The principle of do no harm, which minimizes unintended negative effects. The principle of ensuring access to impartial assistance, which eliminates barriers to access and being intentional for groups and individuals who are marginalized or at risk. The principle of protect people from violence, prioritizing the safety and dignity and prevent or mitigate against harm, exploitation, and abuse. And the principle to assist rights claims, which enables mechanisms for safe and inclusive feedback and support people's ability to support themselves and strengthen their networks of support. Strung across the protection principles are the elements of protection: safety, inclusive, meaningful access, accountability, participation, and empowerment. We'll also be talking about the importance of being prepared to refer a person seeking assistance for a protection concern in your activities. Today, we want to explore some examples from your emergency food security activity and how you make sure that elements of protection are infused in your work. We will also look at COVID, the disruptor. We'll also look at how COVID, the disruptor, has made you rethink approaches and make adaptations to ensure that we can deliver safe, inclusive, dignified food security activities while navigating the disruptions caused by COVID. Next slide, please.
Hey, Kevin, I just want to make sure that folks know how to use the simultaneous interpretation before we dive into the examples. So I see that some of us have joined a little bit late, so I just want to make sure everyone is aware of this function of interpretation, since I think this is relatively new to the Zoom world. So if you are preferring to listen to this presentation in French, you go to the bottom of your screen. There should be an interpretation icon. You can click it and select the language you would like to listen to the presentation in. Also, Kim has shared these slides translated in French in the chat box, so you can follow along there as well. Thank you, Kevin. Back to you.
Great. Yeah, so for the next batch of slides, I'm going to be giving examples of approaches that can be used to address each element of protection and illustrate a scenario that illustrates where EFSAs had integrated the protection element in their programming. So you'll see, just quickly understand how this is set up. On the left side of your screen, you'll see how the protection element is defined. Go ahead and read that on your own. And I will mention a few examples and read through the scenario, which you can read along, which is in the blue. So when we talk about safety, we're talking about different strategies that can be used, such as completing do no harm assessments with conflict analysis and gender and social inclusion lenses, establishing protocols for referrals to protection services, consulting populations to ensure that they are able to access assistance safely, and instituting systems to monitor safety at, to, and from the activity site. Here's an example of an EFSA taking action to make their activity safer for participants at risk of protection concerns. A cash transfer project distributed cash vouchers that a villager could use in a large town market. However, after consulting with young men and women from a village that was located on the opposite side of a checkpoint, the young men and women explained how they were detained and sexually harassed when passing the checkpoint. To mitigate the safety risk at the checkpoint, the program set up a market fair in the village where vendors from the large town came to sell basic needs. Young men and women no longer had to pass through the checkpoint when purchasing food from the activity. Next slide, please. And here are a few examples that can help make sure that marginalized groups and people at risk have meaningful access to food security activities. For example, consulting directly with marginalized groups and people at risk of protection concerns, designating a space or specific hours for the at-risk groups to access assistance, providing mobile services, incorporating universal design and activity sites to ensure accessibility for all, especially people with disabilities. And here's an example of an activity ensuring inclusive access for a marginalized group at risk of protection concerns. At a displacement site, a minority group was physically attacked if they went outside the site. This meant minority households were not cooking meals because women and girls avoided collecting cooking fuel, which they found in the bush outside the site. The NGO incentivized outside charcoal sellers to come into the camp and sell at the market. They also provided cash voucher for purchase to the residents of the camp. This increased safe access to cooking fuel for the minority group, especially women and girls whose responsibility was to collect fuel and cook. Next slide. Thanks. Because food security activities are an essential service, staff, volunteers, partners often build trust with communities because they are seen as someone who can help with the community's many problems, including protection issues, even if that may not be their specialty. This can be especially true when food security activities are one of the few services reaching a community because of COVID. As such, staff, volunteers, partners should have knowledge, skills, and materials prepared and are ready to refer people who have experienced protection problems. Examples include mapping protection services, training staff, volunteers, partners in psychological first aid, having prepared referral pathways with 4 Ws, the who, what, where, when, making sure those are ready, and appointing a focal point. An example of a team to refer a person seeking assistance for a protection concern goes as following. Prior to an assessment of households, food security staff were trained on likely scenarios where they might observe a suspected protection concern. In the training, they learned safe strategies to report their observations and support individuals who requested assistance from protection concerns. During the assessment, the staff felt more confident when coming face-to-face with protection concerns, such as observing a neglected child or speaking with a GBV survivor who explains the intimate partner violence she is experiencing. They were prepared and able to listen, provide necessary information about available protection services, or knew to report their observations to the protection cluster for follow-up. Next slide, please. With accountability, examples include setting up appropriate and trusted feedback mechanisms that are nearby and intentional to marginalized groups, i.e. they have they're using the right language, they are culturally appropriate, they are friendly to people who have literacy concerns. Also making feedback systems confidential, and that feedback entry points are adaptive to the functional needs of people with disabilities and people with limited literacy. So a batch of ways to have them give feedback, such as using audio, pictographs, etc. As an example of how an FSAB made giving feedback easier for a group of people who are hard to reach, one goes as follows. An organization realized that people with disabilities, especially people who have challenges with their vision, were not giving feedback in the feedback mechanism. The organization met the local disabled persons organization. They gave the local disabled persons organization gave tips on how to make information about drop boxes and hotlines more accessible to people with vision problems. The disability organization also suggested collaborating with them because they do regular outreach to the blind. They also suggested keeping a feedback box in their office so that they could assist the blind participants with their feedback on the programming. Next slide, please. So examples of to incorporate participation and empowerment in food security activities include talking directly to marginalized groups and people at risk of protection concerns, testing the participation level of activity to see if participation is consultation only, active engagement, or initiated and led by specific groups of interest. Enable representation and voice of marginalized groups and people at risk of protection concerns in the governance of activities, and ensure different people have the tools to participate, such as providing them information in accessible languages and formats. An example that can promote participation and empowerment of the group of people that are often marginalized goes as follows. A food security program asked women what their biggest time burden was. The women mentioned collecting fuel for cooking took the longest time and also placed them at risk of harassment. They also said, in addition, that some of the women use and make fuel-efficient stoves. Taking that cue, the program designed a project where local women trained other women on how to make fuel-efficient stoves. This dropped the number of days women went to collect fuel. Next slide, please. Finally, we wanted to make sure you saw examples of adaptations because of COVID. And here's one that combines safety and inclusive access. Because COVID, a team knew that older people and people with disabilities would be at higher risk of the disease if they joined the distribution activities. To ensure their safe access, the program adapted its procedures. They identified eligible older people and people with disabilities through community leaders and local disabled persons organizations, and delivered food baskets directly to their home. A second example focuses on accountability. And it goes something like this. To minimize person-to-person contact, participants were asked to share their phone number, and the monitoring and evaluation team conducted their post-distribution monitoring by phone and through SMS in the participant's first language. The message also publicized the feedback hotline phone number. For participants without phones or challenges with operating phones, a group that is much smaller than the total participants, they did a random sample and conducted house visits following COVID health protocols. Next slide, please. Great, and this is just a reminder that we always want to be as intentional as possible so we can best meet the needs of different people in the community and households. That includes people of all ages, males and females, people with different abilities, including challenges with their mobility, vision, hearing, cognition, self-care, that may be things that people with health conditions or people with disabilities have to deal with. People who have different associations, such as being associated to a different ethnic group or religion, language group, sexual orientation, or gender identities. People who have different identities, such as their nationality or displacement status. All of these different elements of a person are going to make it, all these different elements of a person are going to contextualize how we adopt our programming so that we can reach them better. Next slide, please. Great. So that was the presentation, and we're going to go into breakout rooms fairly shortly. But before we do, I just wanted to give a little instruction about how it's going to work. In each of these protection mainstream, in each of these breakout groups, you will have a facilitator and a scribe from IDEAL, and we will be taking notes in a Google Doc. In your groups, you will be given one of the following themes: safety, inclusive, meaningful access, preparedness for referral, participation, and empowerment and accountability. And as you can see on this graph, each one of you will be put into a group that will have that specific topic. During the breakout session, you'll focus your discussion on the theme of your group. We'll start off by talking about protection mainstreaming approaches related to your group theme that you used prior to COVID-19. It's a brainstorming activity to know what protection mainstreaming approaches have worked well, what hasn't worked well before the pandemic. Next, we want to see how COVID has changed our protection mainstreaming efforts. Again, through sharing, we want to know what challenges have we faced with protection mainstreaming since COVID-19 related to the topic, and what adaptations have you incorporated in your activities related to protection mainstreaming and since COVID-19. As we wrap up, we'll be asking the you'll be asked by this facilitator to share your thoughts on where you feel you need more support with protection mainstreaming, especially during this time of COVID. And the facilitator will also ask the group to choose 1 to 3 issues that you can share in the plenary. Please see the chat. There's a Google Doc link that we'll be using for the exercise. You won't have to type into the Google Doc because the scribe will do that for you, but we do encourage that you open it if it's easier for you to view and then follow what has been noted. The breakout rooms will last 40 minutes to discuss your topic with your facilitator. And after the breakout rooms, we'll report out and learn from the discussions of each group. We'll see you back in a couple of minutes. So yeah, look forward to seeing you in the group. Just to make sure, we're gonna come back and we're gonna talk a little bit, do a debrief about what our breakout groups were. So we're gonna ask each group to basically give a very short summary of 1 or 2 things, 1 or 3 things that in your group that you thought were really helpful to hear. And then because we have some English groups and some French groups, we want to make sure everybody can hear. So as you come back, please remember to reset your language channel. So our French group can report in French and you can hear them in English. So what that means again is if you go down to the bottom of your screen where it says interpretation and there's kind of a globe icon, if you can just press that and press the correct language, that will ensure that you'll have the ability to listen to the French group in English. Terrific. So is everybody ready to continue? I don't think we have the ability to say yay, but you can wave, you can do something. Anyways, so maybe we can start, as I said, we're gonna ask you guys to summarize. So maybe we can start with group 1, which is about safety. And what were some of the key issues that came out in the discussion group? So again, if there's last chance for group 1, if there's somebody who wants to volunteer, and if not, that'll be me. So yeah, so going back to some of the key issues that came up, you know, safety obviously is a concern for everybody, and there were a lot of really interesting ways in which our colleagues were describing how they navigate safety and infuse it into their programming. In particular, you know, one was around having smaller groups and making it easier to manage and reduce crowding at distributions. And particularly with COVID, that also meant even making it even smaller groups than what they had done before, but also making sure that teams had masks and that there was sanitizer available for participants as they come through the lines to reduce the to both deal with the issues of crowding, but also to reduce the person-to-person contact that is so dangerous with COVID. One of the challenges that people brought up that was interesting was a shift from single to double distribution. So where initially they were providing because of COVID, they were having problems with, and again, if somebody wants to repeat this for me, problems with making sure that people were able to use their food safely. So initially the idea was to distribute every 60 days rather than 30 days. But then through discussions with participants, they also found that distributing through 60 days was a challenge for people to hold on to their, to be able to manage their food over that time period. So as a result, they were seeing negative coping mechanisms. So this kind of debate between some of the immediate protection concerns where people were people were being harassed or abused as they were moving their foodstuffs to their home, versus the long-term effects where people didn't have enough food over the long period and thus were resulting in negative coping mechanisms. And then protection measures of distancing were viewed negatively by the community. That was another issue that came up. And then there was also this issue of how do we deal with social media messages that promote rumors that can have both negative effects to, people not really understanding why COVID is an issue and what those safety ramifications are for the programming as well. So I'm gonna pass on to group two. Does group two have points that they wanna bring out and summarize from their discussion?
Oui, bien sûr.
Bon.
Je pense que c'est mon groupe, c'est par rapport à l'accès. Un moment, s'il vous plaît. Voilà, par rapport aux difficultés que nous avons identifiées par rapport au contexte COVID, c'est que d'abord, il y a, pour que toute la population puisse avoir accès à l'assistance ou bien à notre réponse, il y a en prélude de cela des sensibilisations qui devaient se faire pour réunir plusieurs personnes et leur passer les messages. Et avec COVID, ce n'était plus possible de réunir beaucoup de personnes et disséminer le message pendant ces temps-là. Et du coup, on devait multiplier les nombres de rencontres en limitant autant que possible les personnes qui doivent y participer, ce qui nous prenait beaucoup plus de temps pour la mise en œuvre de projets, des programmes d'assistance. Donc, il y a le contrainte de temps, le temps qui est un peu plus élargi. Et puis aussi, il y a les coûts budgétaires que ça pouvait occasionner. Donc, avec le contexte COVID, les planifications avaient été faites avant le contexte. Et après, il y a d'autres coûts qui se sont ajoutés, qui ont impacté négativement, du moins qui ont impacté sérieusement les budgets aménagés aux différentes interventions. Et du coup, quand il fallait acheter des gels, il fallait prévoir de max, etc., ça avait de l'incidence sur la réponse, sur le budget alloué. Il y a aussi l'aggravation des vulnérabilités des personnes. Donc, avec le contexte COVID, les personnes à besoins spécifiques, surtout les vieillards, les femmes enceintes, se voyaient un peu plus exposées au virus et du coup, ils ont du mal à vouloir participer à toutes les activités autour de l'aide, de l'assistance et sécurité alimentaire. Et puis, de notre côté, nous avons aussi, par rapport à la collecte des informations, il nous a été révélé, selon les expériences d'autres participants, que pour pallier pour éviter de faire des collectes de données en présentiel avec les participants au programme, on préférait peut-être le faire à l'intermédiaire d'un téléphone, des appels ou bien et des questionnaires ont été administrés de façon électronique, ce qui impactait sérieusement la qualité d'informations à collecter et pouvait faire à ce qu'il y ait certaines personnes qui n'aient pas accès à l'assistant tout simplement parce que on n'a pas collecté la bonne information sur ces personnes-là. Alors, il y a eu...
Thank you very much. Just for time, we're just going to move to the next group, but I really appreciate all your input. So group 3. Merci.
So I can step in quick for group 3. I was a scribe, and since I'm sharing my screen, unfortunately, I haven't had a chance to move some of the key highlights over. But our group really talked about challenges in terms of the community not trusting what was being shared about COVID. So they undertook, as an adaptation, they undertook a lot of sensitization campaigns, SBCC, using multimedia, local radio to sensitize the community about COVID. Referral was very important. Many of the organizations already had a robust protection and referral system in place. However, with COVID, it just, it was a great challenge. So they worked very closely. They had to work closely with community leaders, government organizations, as well as staff internally, their protection clusters, et cetera, to improve referrals. And finally, looking at markets, they had to adapt their distribution points. So markets, prices increasing, markets shutting down, and inability to sell produce or goods. There was a real challenge. So they adapted by increasing distribution points, working with next of kin to mitigate those who had chronic illness so that they weren't in attendance, and then distributing PPE and really enforcing strict social distancing at the distribution points themselves.
Great, thank you. And group 4. Group 4 was on accountability.
Oh, sorry, we're on participation and
participation.
Yeah, so I can present out for group 4, and if I miss anything, they'll let me know. So there was a lot of both successes and challenges shared as it relates to participation and empowerment with the group. One of the interesting things we noted was how the context of Nigeria was a really good insight into already how to adapt to a lot of the restrictions from COVID, because they'd already been having a lot of challenges reaching accessible communities. So some of the main challenges were related to what other groups have said about misinformation and disinformation around aid workers and concerns that they were the ones spreading the illness. Also just overall challenges in accessing the most marginalized. So some of the methodologies that people were using is, identifying key stakeholders at the district and NGO, larger groups, so that they could understand some of the vulnerabilities within the communities, engaging with community volunteers. And, some of the key adaptations that were made in terms of practical food distribution were, constructing areas where people could wait with chairs that were safe, if people had disabilities or were older. Also doing remote, top-ups for cash vouchers. The areas where people wanted more support were just in terms of peer-to-peer knowledge sharing, such as this event. Also kind of guidance or standardized note on adaptations, how other groups have been, sharing best practice and knowledge from a group like this. And then also just a request to strengthen coordination between protection, food security, livelihoods, and nutrition partners, including the expansion of the categorization of vulnerable communities, more coherence around implementing partners. And then finally, it was just capacity building and support around communicating with communities. And I think that this touches on points other groups have made on, how to actually share awareness and share information with these communities when you're kind of wading through a lot of misinformation and disinformation and fear, and just how to bridge that gap, making sure that you're talking to people in languages that they understand and in methodologies which are accessible to them. Thank you. Did I miss anything from the other group, or I don't think we have time, right?
We have the last group, which is group 5. If you can go wrap it up really quickly, which was around accountability.
Thank you very much. In group 5, there were key things that came up in terms of how beneficiaries reached out. But there was also disruption because of the COVID, especially now that we didn't have people field visits, we didn't have field visits, we don't have office visits. So some bit of decreased complaints were received, but in effect, trying to make sure that we use platforms that ensure social distancing, like toll-free lines. Efforts were increased, but still there were fewer women and children sharing feedback, especially with regards to safeguarding issues. And key adaptations that were made were maybe changing the name to make it more appealing or more comfortable for the communities. Rather than calling it a CRFM, just call it, one group called it feedback and accountability mechanism, which made it more appealing to and easier for the beneficiary communities to give feedback. There was also training of enumerators and volunteers on specific issues and how to reach out, use of WhatsApp, and also especially in terms of communicating and issues that specifically to safeguarding, use of faith leaders, and which are more of the community structures came in handy. Key things that were raised in terms of areas of support, there's need for evidence-based examples of awareness raising with regards to safeguarding and understanding of their rights. And there are requests of maybe visuals, resources, and other methodologies that have been used by other organizations. On the other hand, there was also a request on maybe capacity building in terms of doing protection risk assessments for partners. That will be really key. And also in terms of more capacity building with regards to ensuring that actors are able to effectively conduct to handle safeguarding issues within these communities, because some communities have these are considered to be sensitive issues to be discussed. So yeah.
Great.
Thank you.
Thank you very much. Sorry, we are running low on time, so we're gonna really appreciate everybody's time in the groups and your share out. We're gonna put up a poll to look at areas of interest for continued learning so that we can figure out how to continue more services. So more sessions. So in this poll, it asked a couple of different things. For instance, effective strategies for addressing SGBV, strategies for addressing stigmatization and disinformation, effective strategies for community consultation, communicating with low literacy populations, examples of guidance notes for effective community consultation, strategy for cross-sectorial coordination, and how to conduct context analysis. If you guys can vote on the poll what most interests you, that'd be terrific.